All right, well, thank you everyone for having me. My name is Carl. I'm the winner of the Curate Prize. I wanted to talk to you today about the inventive process, and I wanted to share with you a little bit about my path to invention and sort of why I started inventing. I don't know about you, but when I think about why people invent, I really think about 5 main reasons. Some people have to survive, necessity. Others want to help people or change the world. And still others just like solving problems, or maybe even invent by accident. Now this is the why people invent, but there's also the when people invent. And unlike all of you who have started in high school or even earlier, I did not start so long ago. Certainly not as a kid. But I liked to what I call tinker. I liked to build and put together little things. I really liked playing with erector sets. Erector sets are amazing. I liked playing with Legos. I have to be honest though, I don't think anything I built was as cool as these two. I did not build the Death Star or a helicopter. So you see, I wasn't really inventing anything, unless, new ways of injuring your parents by leaving out said models on the floor for them to step on counts as inventing. But I think the problem was I didn't have one of the 5 motivations to invent. And even more important, I don't think I personally realized that I could invent. I thought it was only the people you read about in history books who were allowed to do that sort of thing. So now you fast forward a decade or 2, and I'm at MIT, and I think I realized for the first time that I could invent. And so I started looking for a problem. And I found a problem. And those are shots and injections. They are universally disliked. Everyone hates shots. They're painful and they're invasive. The problem is that a lot of drugs can't be given in a pill because they'd be broken down in your GI tract, so they have to be injected. So now I wanted to be creative, and I wanted to think of a great way to do this, but it obviously wasn't ready yet. So I found myself suddenly having an extreme and personal dislike of shots with some necessity. Okay? Never wanted a shot ever again. So I thought to myself, how can we make these drugs deliverable without injections? Preferably with a pill. And the way I thought of doing that was actually with the microneedle pill. Now everyone knows injections work from the outside. So naturally, being a smart MIT student, I thought to myself, why not from the inside? I've gotten a lot of great feedback from you guys over the last few days. Maybe it wasn't such a great idea. But this is one of the best, things about being an inventor and tackling problems. You can be as creative as you want to be. You can tackle and approach the problem however you want. You can even create something that looks like it belongs in a medieval torture chamber and win awards for it. But in all seriousness, why did I think this was a good idea and how does it work? Well, the GI tract, so your gut, is actually insensate. It doesn't feel pain the way the skin does when you get an injection. So this presents a very interesting opportunity for the use of needles. Now, the microneedle pill would look just like any capsule, although from the feedback I've gotten, it needs to be larger with more needles, so we're working on that. It would have a drug reservoir to house the medication and a pH-responsive coating to aid in ingestion. So once the pill reaches the gut, the coating dissolves, and the squeezing motion of the tissue compresses the reservoir. The drug is injected directly into your tissue. So now we tested this with insulin. Insulin is used to lower blood sugar in patients with diabetes and is not able to be given with a pill. It has to be injected. So I looked at delivery with 3 different ways. So either traditional subcutaneous injection, so through the skin, what we've all had, with a microneedle pill or a GI injection, and finally simply orally, which we expect not to work. And indeed, what we found was that injection via the GI tract, so using the microneedle pill, resulted in significantly greater drops in blood sugar. So it was actually enabling the insulin to get into the tissue and have a systemic effect, even better than the traditional needle and syringe from your doctor. And as expected, the oral route without the use of needles had no effect because the insulin is broken down before it's taken up and can lower your blood sugar. So now this is efficacy, but the other very important question is obviously safety. Is it safe? I'm sure you've all been wondering about this since the moment I showed it to you on the board. And the very simple answer is, it is. It's very safe. It's actually surprising, but it's known that sharp, irregular-shaped objects can be passed naturally without any issues. Even things like razor blades or shards of glass. I don't recommend it, but they can be passed safely. So I also tested this and confirmed, in fact, the pill could be passed safely. This is not me personally. I want to point that out. And we're also working on a second version of the pill. It's actually made of sugars and polymers that are designed to dissolve. That would leave absolutely nothing left at the end. This is probably a little more tolerable for a lot of people. Now I want to quickly touch on sort of why I tackled this problem. So injections are sort of widely relatable. Probably everyone in this room has had an injection, so it's easy to relate to. But what about problems we can't relate to, or problems we don't have a personal connection to? Can we still work on those problems? And I think we can. And I think a lot of times those problems are actually more important than something that affects yourself, because you can impact millions of people and help millions of people. The Microneedle Pill was a collaborative effort between engineers like myself, chemists, kind of like myself, I'm a chemical engineer, and even doctors. And by working with them, they all brought something different to the table to make the project a success. But I also learned about many other diseases that didn't necessarily affect me, but that were very serious and affected a lot of other people. So suddenly I found myself with slightly different motivation, wanting to potentially help others through my work. So this led me to invent a second device for actual localized drug delivery in the GI tract. So this device can be useful in many diseases that affect the gut tissue directly, like inflammatory bowel disease. These are a horrible set of conditions that affect millions of people worldwide, where the standard of care is delivery, inefficient delivery, over hours, overnight. What this device does, it enables the drug to get to where it needs to go in only 1 minute. So hopefully this will have an impact and really be able to help a lot of people. Now I hope both devices can get to the clinic, help people. I'm sure you're all very excited to use the pill. I think they can help people actually adhere to their drug regimens, take their medicine, and live healthier, better quality lives. So in the 2 minutes and 8 seconds I have left, I want to leave you with a couple little tidbits I had to learn the hard way. You probably already know them. The first is that everyone can invent. Okay? It's not just the people in the history books. Everyone can invent, all of you. You're already doing it, so you didn't need to know that. But the second thing is just start. Start now. You don't need to wait for a problem to find you. You don't need to start with some grandiose plan. You don't need to cure cancer. It would be great if you did, but you don't have to start there. Finally, as I emphasized, you can solve other people's problems. And these are some of the greatest problems sort of facing the world right now. And finally, be creative. If I can create a pill with scary needles poking out of it, you can too. 1 second. I'm not done. I need to thank a lot of people. First and foremost, the Lemelson-MIT program, the Lemelson Foundation, and especially Mrs. Lemelson for your incredible support and mentorship. Very little of this would be possible without you. My advisors here, Professor Robert Langer and Daniel Blankstein, the entire 100-plus person lab who helps bounce ideas off of us, the local hospitals, Harvard, although we don't like to talk about them too much, and my funding from the National Institutes of Health. Thanks so much.
Hi. So I know you said it passes naturally, but what would happen if you were to vomit?
Then I guess it would pass the other way.
But is that an issue, though?
So I mean, in the coating that's designed, you could have a coating that's designed to dissolve at very far places in your GI tract, at which point, if unfortunately you did throw up, it would be beyond your stomach. Only your stomach contents are coming up. If it's in the stomach, the coating probably hasn't dissolved, and so that wouldn't be an issue.
Okay.
Great question. Thank you.
Is there, like, will it cause, like, internal intestinal bleeding, or can it possibly leave, like, scar tissue?
So the tissue is actually lined with a very sticky substance known as mucus. And this sort of lubricates and protects the tissue. That's one of the reasons why, for example, even things like razor blades can be passed safely. So the needles are really getting through that first mucus layer and getting the drug into the tissue. So you're not really causing any macroscopic injury to the tissue. There could be certainly cases where something severe has happened, but there's strategies to mitigate that, like designing the pill from dissolvable materials.
I just wanted to ask, what exactly did you test your pill on? Because I remember you saying you didn't test it on humans.
So this was tested in large animals. Not humans.
I was just wondering, how is this different than another method I've heard of, like nasal? Here it is. Have you heard of that?
No, I have. That's a great question. So nasal delivers the drug directly to that tissue lining, but you still have the issue of that mucus barrier, basically a thick, gooey substance. And it's very hard for the drug to actually get through that substance. And even if it does start getting through that substance, there's actually little bugs and proteins that eat the drug up and render it useless. And so without sort of the physical action of the needles, you're sort of limited to smaller molecules to be delivered via that route. I think we have maybe time for one more question in about 20 seconds.
What's this made of? Like the needles and stuff?
So the ones I showed are stainless steel.
Thank you.
Thank you so much, guys.